Hi again, YouTube. So today was my third surgery appointment this week. So right now there are three possible avenues of getting my mastectomy and reconstruction done, but it seems like they are each exclusive. So Avenue 1, off-base husband and wife team. Avenue 2, Veterans Administration Hospital, and Avenue 3, military hospital. So Avenue 1, I went to go see the general surgeon, the breast surgeon, the wife side of the husband and wife team on Tuesday, I think, Wednesday. And I said, hey, so I have these other questions and I wasn't really comfortable. Your husband really was chop, 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 looking at his watch the whole time. So I'm not sure how comfortable I am, and I'm really concerned about timeline. And so she answered my questions, and I felt quite a bit more comfortable, but the person I need to have a long-term relationship with is definitely her husband. But I asked important questions like, will you take a sentinel lymph node, and will I get lymphedema, and talk to me about recuperation, and how often will I see you at the end of the surgery, and when can I start driving again, and stuff like that. And she answered quite a few of those questions. In fact, I got those questions from breastcancer.org, and then I added to them personalization for myself, the kinds of things that I care about. So breastcancer.org has a really great set of questions to ask both your general surgeon and your reconstruction surgeon. And so I did come up with a list, and it's a pretty good sized list of questions. And so I went and saw her, and that was okay, but I'm still not really comfortable with her husband, and that's the long-term relationship that I need to have at the end of this thing. So that's option A. Option B, I went and saw yesterday, general surgeon at the VA hospital. I absolutely love her. Her attitude is amazing. Her approach is understandable. She educated me and said, this is what I'm going to do. This is why I'm going to do it. Here's some surgical choices that I make, and here's my role. This is how I feel about how we're going to save your nipple, but still get enough breast tissue that we leave the least amount of risk for cancer. Yes, I'm going to take a lymph node, right? Really amazing. I haven't met the VA plastic surgeon, and I'm not sure I intend to, because he's the one that trained the husband team of the off-base husband and wife team. And I met his nurse's assistant, who was gruff and chop, 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 business. She's the one that actually checked me in yesterday. And I feel like those people are probably really professional, but it feels like they're the kind of people that would describe their patients not as people, but as cases or as clients. And I would like to be described as a patient, or a person, right, by name. So for me, definitely an issue that they are that similar kind of doctor. So love that general surgeon. Not in love with the idea of having that plastic surgeon at all. Haven't even met him and don't think I want to. Option 3 happened today. The plastic surgeon on base under option 3 is the one I adore. I think he's amazing. I've only met him once, and in that time he sat with me, he drew pictures, he explained to me what's going on inside my breast. He talked to me about his concerns with direct to implant. He talked to me about pros and cons of that. He looked at my breasts, and then he talked to me about specifically the surgery as relates to today's breasts and my future breasts. He talked to me about the pros and cons of getting tissue expanders and why he would prefer to do that and the kinds of things he would look for and when we move on to the next step and when do we do surgery and how do we decide. Amazing. And it wasn't like, this is what we're gonna do. It was like, here's the pros and cons of these two approaches. I prefer this, and this is why. How do you feel after this conversation? Are you still wanting to go? At that time, I wanted to go direct to implant. So his entire approach is education, and he feels accountable. These are the decisions that I make. This is the way I make these decisions. This is why. Absolutely love his approach. So his assistant called me on Wednesday and said, hey, we have a surgeon who's willing to see you and who would be willing to consider doing your mastectomy. Okay, great. Can't wait, because I would really like to have Dr. So-and-so do my reconstruction. So I go in today to see this surgeon, and she basically says, this is your case. Do I have your history right? Yes, you do. Okay, so I understand your plight, and I'm willing to do the surgery. We can discuss dates at the end of this thing, but really it's because Dr. So-and-so approached me that I'm willing to do this. He is on board with it, therefore I am willing to consider it. So I'm in a support role in this case. Okay. So while she's doing the breast exam, she says, do you have any questions? Yes, actually. Where are you going to do the incisions for the mastectomy? I'm going to do them wherever Dr. So-and-so says I'm going to do them. I'm really, literally in a support role to him. Not going to make any decisions? Like, that just felt weird, because as a breast surgeon, you should still have some choices. You should still have ideas, and like, no, I'm not going to be able to get all the breast material that's up by the collarbone. I'm not going to be able to get that if you make me cut her below. Like, I'd kind of like to do an extra like, right? Don't you have some opinions? So that part bothered me. And then I said, what about lymph node? You're going to take a lymph node so that you can check my... No, I'm not. Well, why aren't you going to take a lymph node? Like, just, the other breast surgeons I've talked to have said, while we're in there and the breast material can still... We put some dye in while your breast material's still there, so that the dye will lead to the sentinel lymph node for the breast. So while we have that opportunity and you still have a breast, we would like to do that, so that if this comes back cancerous, we already have taken that lymph node and tested it, so we can judge our future. And what we're talking about here is whether or not the cancer has made it to the lymph node and may metastasize, right? So I say other surgeons, that's not what I said to her. That's for you guys. What I said to her was, other breast surgeons have said they would take it, and while you still have the breast, why wouldn't you put the dye in and take the lymph node? Well, if you already have you open, there's a bigger chance of infection if I make more incisions. I don't want to do extra incisions if I don't have to. You've already had 4 biopsies. There's not cancer there, therefore there's no reason to do this. This is a prophylaxis. We're just doing this for reconstruction. If you actually had cancer, then I would be taking the lead on this surgery. But since you don't, this is really just for reconstruction. So I'm removing breast materials so that Dr. So-and-so can do your reconstruction. So I'm allowing him to take the lead. And therefore there's no reason to take a lymph node. And I was like, well, what about now the breast is out, and then it comes back that I do have cancer that we've just kept missing with these biopsies. What happens when that comes back cancerous and you haven't taken a lymph node? How are you going to know which one is the sentinel lymph node? Oh, I will. I do it all the time. I don't know what that means, because both of the other surgeons, in particular, the off-base surgeon who has done her fellowship on breast surgery, definitely wanted to take a lymph node. It feels like an opportunity lost and an unnecessary risk for me to have cancer that's already metastasized. Like, that's ridiculous. So that upset me. And then, as she was doing her breast exam, she said, I want you to know, I do not support your decision to keep your nipples. I don't agree with keeping the nipples. I feel like there's breast material there, and you just really, I don't support that decision. And I was like, well, okay, I'm going to keep them anyway. How often do you do nipple sparing mastectomies? Almost never. I never recommend it. I almost never do them. So it's very rare if I do one. And the gruffness and the abruptness felt like, are you going to give the backside of my nipple the care that it needs so that it still has a blood supply, so that it's still viable when you're done? Or are you so vehement about not keeping nipples that when you're done, I'm not going to be able to keep the nipple because it's going to die? Like, the 2 biggest concerns I have are that she's gonna put my nipple at risk, and that she's not gonna take any lymph nodes. That is just confusing to me. I don't understand it, and I don't know if I want to take those risks. And so now here we are, 3 surgeons later, and I am at another impasse. I am once again, the patient trying to make decisions that I have no business making, and I'm lost and I am frustrated, and I just want to have the best possible outcome of this major life event. And it feels like I'm gonna have to pick the least shitty of my choices. Do I want a doctor, a husband and wife team where I might not feel good, And I'll be treated like a second-class citizen a little bit, and chop chop, let's get you through here. But I may have a good visual outcome, so it won't matter in the long term. Or do I go with a plastic surgeon that I think is great, but who might not be able to overcome, a breast surgeon who feels like, really, her attitude felt like she was arm twisted into this. So how is she really going to treat me when she's cutting into me? Or do I go with a breast surgeon that is amazing, that I love, and I love her attitude, and I love her approach? I don't know shit about her plastic surgeon, except that he's probably not going to be great. Such are the struggles of breast cancer. Or cancer, no cancer, because that's part of what's making this so difficult, is the attitude or the perception that people have about an elective mastectomy. Like anyone would elect to get a mastectomy. And we're back to me in the most jacked up way you can imagine, sort of hoping that this is cancer, so that this will have been worth it. And so that people won't think that I was, an afraid little hypochondriac or whatever. Anyways, another interesting day on the breast cancer trek. Now I'm going to go to lunch with a very good friend of mine, haven't seen in years, and I'm not going to have to talk about this anymore because I'm going to feel better, because I vented it out to you guys. So thanks for listening.